So I saw a video of a medical student saying, like, hey, we should have a nursing rotation so we see what their job is like and all those things. And there were a lot of comments that were like, me, I'm for doctor school, I'm not a nursing school. But that's not the point. And here's some examples of why that's useful. Because I had a rotation like that briefly when I was in the beginning of residency. Think about a lot of things that you just order reflexively. Like a GI bleed gets put on a PPI drip, even though the evidence says that just putting on a PPI twice a day is just as effective. Why would you care as the doc? You would care because the drip can take up a line and is not compatible with a lot of other things. Why do a heparin drip as opposed to a Lovenox? Well, a heparin drip takes up a line, and oftentimes you're just like doing the order and you don't really care until the patient has no more access, and then they ask you to put in an ultrasound IV or a triple lumen or whatever. Then you care. Or some other things. I remember being on my medicine rotation as a medical student, and 5 of morphine was like the favorite thing to give, or 2.5 of morphine. Well, what does that mean? A lot of times morphine comes in 2s or 4s, but if you don't use the entire vial, you're not only taking one nurse who needs to drop that medication, deliver that medication, they also need to waste that medication. You are increasing the demand of not just one nurse, but 2, by things that you could just not make them do that. Does your shop use normal saline, or do they use lactated ringers? What is that compatible with? It makes a difference. If you have like a sick COPD exacerbation, but they need fluids and steroids and antibiotics and magnesium and nebulizers, and we reflexively put all these things in, that is a direct outcome with what one of your colleagues needs to do at work. If you have a patient going through alcohol withdrawal and you do Ativan, but you need to redose that every 5 seconds, as opposed to Valium or phenobarbital, that has a demand on their already strapped workload. If you have a patient with renal failure and they have hyper K, are you going to do 10 of insulin and then you need to check finger sticks every 20 minutes, or are you going to do 5 because the evidence of that is better? And there's nuance to all the medical nerd stuff, but the point is, if you have no awareness at all of what your actions as a resident or a doc has on other people in the team, you're doing them a disservice. So, right, like I never went to nursing school. That's not what my training is. But the school I went for was to work within a team to have good patient care. That's the point.